Well, hello there. Good evening. I welcome you to my video. I'm Dr. Sofía. Nice to meet you. First of all, I don't want to start my video without explaining why did I choose this topic, and why am I enjoying a coffee talking about why did I choose this topic. Well, first of all, I need to confess something. I'm a coffeeholic, While I was searching, the topic that I was going to talk about, I was thinking I don't want to repeat a topic. I don't want to talk about a topic that everyone's going to talk about, like COVID, like, I don't know, diabetes or something like that, And then I really wanted coffee. So while I was searching, the topic that I was going to talk to you about, I found it. The perfect topic. You don't have any idea what it will be? Well, if the coffee gives you a clue, I'm sorry. Yeah, it's coffee and caffeine. But I'm gonna ask you to come with me to my office so we can talk about this topic, so I can read you these amazing things that I discovered. So come with me. So welcome to my office. Please have a seat. Put yourself comfortable so we can start. Well, hello again. Now we're in my office. We're ready to start, and I really hope that you are comfortable and you're ready to enjoy this amazing topic that I found. As I mentioned you early, I chose this topic because I'm completely a coffeeholic. I'm guilty of that. So I really wanted to know what would be the effects in my body if I still consuming, and that's what I do, coffee. So I really invite you to be comfortable and to enjoy this topic named Coffee, Caffeine, and Health. Cheers. Coffee and tea are among the most popular beverages worldwide and contain substantial amounts of caffeine, making caffeine the most widely consumed psychoactive agent. A variety of plants contain caffeine in their seeds, fruits, and leaves. Besides coffee and tea, these plants include cacao beans and guarana berries. Caffeine is widely used as a treatment for apnea of prematures in infants, and caffeine and analgesic agents are used together in pain medications. In addition, people use coffee beverage to increase wakefulness and work productivity. Cheers. Concerns have long existed that coffee and caffeine may increase the risks of cancer and cardiovascular diseases, but more recently, evidence of health benefits has also emerged. A key issue in research on caffeine and coffee is that coffee contains hundreds of other biologically active phytochemicals. Thus, research findings for coffee and other dietary sources of caffeine should be interpreted cautiously, since effects may not be due to caffeine itself. Metabolism, physiological effects, and toxic effects. Absorption and metabolism. Caffeine absorption is nearly completed within 45 minutes after ingestion. The activity of caffeine metabolizing enzymes is partly inherited. A variant in the gene coding CYP1A2 is associated with higher plasma caffeine levels and a lower ratio of paraxanthine to caffeine. Persons with genetically determined slower caffeine metabolism tend to compensate by having lower habitual caffeine intake than persons without this genetic predisposition. Caffeine can affect the action of various drugs, and clinicians should consider possible caffeine-drug interaction when prescribing medications. Beneficial effects on cognitive performance and pain. The molecular structure of caffeine allows caffeine to bind to adenosine receptors, block adenosine, and inhibit its effects. Accumulation of adenosine in the brain inhibits arousal and increases drowsiness. Caffeine can antagonize the effects of adenosine and reduce fatigue, increase alertness, and reduce reaction time. Cheers. Although these mental benefits are most pronounced in sleep-deprived states, caffeine cannot compensate for the decline in performance after long-term sleep deprivation. Caffeine can contribute to pain relief when added to commonly used analgesic agents. Effects on sleep, anxiety, and irritation and withdrawal symptoms. As expected from its effects on fatigue, caffeine consumption later in the day can increase sleep latency and reduce the quality of the sleep. Caffeine can induce anxiety, particularly at high doses. An insensitive person, including those with anxiety or bipolar disorders. Caffeine consumers and physicians should be aware of this possible side effects of caffeine. High caffeine intake can stimulate urine output, but no detrimental effects on hydration status have been found with long-term intake of moderate doses of caffeine. weak caffeine intake after habitual consumption can lead to withdrawal symptoms, including headaches, fatigue, decreased alertness, and depressed mood, as well as influenza-like symptoms in some cases. Cheers. These symptoms typically peak 1 to 2 days after cessation of caffeine intake. Toxic effects. Side effects of caffeine at very high levels of intake include anxiety, restlessness, nervousness, dysphoria, insomnia, excitement, psychomotor agitation, and rambling flow of thought and speech. I think I'll quit waiting. Caffeine poisoning from consumption of traditional sources of caffeine such as coffee and tea is rare because a very large amount, 75 to 100 standard cups of coffee, will have to be consumed in a short time for the dose to be fatal. Caffeine-related deaths have generally been due to very high doses of caffeine from tablets or supplements in a powder or liquid form, mostly in athletes or patients with psychiatric disorders. High consumptions of energy drinks and shots, especially when mixed with alcohol, has also been linked to adverse cardiovascular, physiological, and neurologic events, including fatal events. Caffeine in the form of energy drinks and shots may have more adverse effects than other caffeinated beverages. Persons who consume energy drinks should thus be advised to check the caffeine content and avoid high consumption. Coffee, caffeine, and the risk of chronic diseases. Methodologic considerations. Studies of caffeine intake and health outcomes can have severe potential limitations. First, observation of the acute effects of caffeine may not reflect long-term effects because tolerance of caffeine effects can develop. Second, epidemiologic studies of caffeine intake and the risk of chronic diseases are potential confounding by smoking or other unfavorable lifestyle factors. Recently, Mendelian randomization studies have used genetic variants as proxy variables for caffeine intake, but limited statistical power and potential heterotropy of the genetic variants complicated interpretation of the results. These proxy variables can be misleading. Third, measurement error can affect the assessment of caffeine intake. Variation in cup size, brew strength, type of coffee bean, and the amount of sugar and milk or cream added to coffee is generally not captured in epidemiologic studies of coffee consumption, resulting in some exposure misqualification. Finally, in prospective studies of caffeine intake, coffee and tea have been two predominant sources of caffeine. It is unclear whether the observed outcomes with this caffeinated beverage also apply to other sources of caffeine. Blood pressure, blood lipids, and cardiovascular diseases. In persons who have not previously consumed caffeine, caffeine intake raises epinephrine levels and blood pressure in the short term. Meta-analysis of trials of longer duration indicates that isolated caffeine intake results in a modest increase in systolic and diastolic blood pressure. The concentration of the cholesterol-raising compound caffeine is high in unfiltered coffee, as compared with filtered coffee, predicting an estimated 11% higher risks of minor cardiovascular events. Filtered coffee did not increase serum cholesterol levels. In fact, coffee consumption was associated with a reduced risk of cardiovascular diseases with the lowest risk. Weight management, insulin resistance, and type 2 diabetes. Metabolic studies suggest that caffeine may improve energy balance by reducing appetite and increase the basal, metabolic rate and food-induced thermogenesis. Limited evidence from randomized trials also supports a moderate beneficial effect of caffeine intake on body fatness. However, caffeinated beverages that are high in calories, such as soft drinks and energy drinks and coffee or tea with added sugar, may lead to excess weight gain. Caffeine intake reduces insulin sensitivity in the short term, as assessed with a euglycemic clamp. This may reflect an inhibitory effect of caffeine on storage of glucose as glycogen in muscle. However, consumption of caffeinated coffee for up to 6 months does not affect the insulin's resistance. Cancer and liver diseases. Consumption of coffee and caffeine is not associated with an increased incidence of cancer or an increased rate of death from cancer. Coffee consumption is associated with a slightly reduced risk of melanoma, non-melanoma, skin cancer, breast cancer, and prostate cancer. Coffee has also consistently been associated with other aspects of liver health. Caffeine may prevent hepatic fibrosis through adenosine receptor antagonism. Better be. Lithiasis. Coffee consumption has been associated with reduced risk of gallstones, and of gallbladder cancer. Coffee consumption may prevent cholesterol gallstone formation. Neurologic diseases. Consumption of decaffeinated coffee is not associated with Parkinson's disease. Caffeine prevents Parkinson's disease in animal models. Coffee and caffeine consumption have also been associated with reduced risk of depression and suicide. Cheers! All-cause mortality. Consumption of 2 to 5 standard cups of coffee per day has been associated with reduced mortality. Coffee consumption was associated with lower mortality in analyses restricted to participants without chronic diseases or pooled self-rated health. Consumption of caffeinated coffee and consumption of decaffeinated coffee were similarly associated with a reduced risk of death from any cause. Better be! Effects of caffeine intake during pregnancy. Higher caffeine intake has been associated with lower birth weight and a higher risk of pregnancy loss. Caffeine really passes the placenta, and the slow caffeine metabolism in the mother and fetus can result in high circulating caffeine levels. Caffeine may induce uteroplacental vasoconstriction and hypoxia. Although the evidence for adverse effects of caffeine on fetal health is not conclusive, prudence suggests limiting caffeine consumption during pregnancy to a maximum of 200 milligrams per day. Conclusion. Consumption of 3 to 5 standard cups of coffee daily has been considerably associated with a reduced risk of several chronic diseases. However, high caffeine intake can have various adverse effects. Well, welcome back. That was all. I really hope you enjoyed it as much as I did. I really enjoyed the searching, the reading, the resuming. I really enjoyed it. I hope you did too. All the reading. I want to share with you my personal conclusion of this. I think it's really important for us to know what is good and what is bad to our health. You know, coffee can be both if we took it with responsibility or we don't. We need to be capable of taking decisions that may not or may affect our health. I want to share with you something personal. While I was in first semester, I thought it was like a joke that coffee can damage, coffee can cause some things, and I didn't realize that I was hurting my body. I mean, I knew it was good at some point, but I just jumped at that point. I wasn't joking about my coffee addiction, but that's why I chose this topic, because I really wanted to understand what was going on. And I think it's really important to share with all of you so we can make decisions, so we can quit some things. And it's important for us to realize that caffeine is not only in coffee or in tea. It's really important for us to have the acknowledgement of all it is really. So this is why I wanted to share this with you. So thank you. Once again, my name is Dr. Sofía, and I really hope